Alright, so what we're looking at is a plantar second metatarsal head corn. So it's just a corn and the location's under the second metatarsal head, so that's all that technically means. So you can see it's got this large callus cap, so basically we go ahead and remove the callus cap and then we can see what actually the hard central section is. So if you remember, we always describe the corns like they're an ice cream cone, so upside down, so the ice cream's towards the outside and the cone is towards the inside. So we go ahead, we're just removing what we call like the ice cream section there. Not everyone, just me. And you can actually see that hard central section. It gets really hard, and you can actually feel that with your thumb. When you run your thumb across it, you can actually feel that it's got a hard, it's almost like a little piece of stone in there. So we're using the number 15 blade here just to go in there really, really carefully. Now this one's not sped up at all, and this one's not live, so I'm voicing this over afterwards. And so obviously you can see that little hard beer bottle coloured section in there. That's the thing we need to get out. So we usually go ahead and just really gently remove as much of the surrounding tissue as we can, so there's not as much to actually cut out, and we don't need to put as much pressure on the skin, because when we put pressure directly on the corn, it will it pushes from the base or the ice cream section down into the pointy bit. So once we've got all that callus cap removed, we go ahead and just basically use the tip of the 15 blade here just to cut around that edge of the living and the dead skin. So you can see, not quite sure if you can actually see here, the right around the edge there's a little white ring around this one. So we know that's where the hardened corn tissue is, and it's pushing the tissue fluid out into the living skin. So you can see it's got this whitened section, so it gives us a little buffer to cut through without causing too much blood. If we get a little bit of blood, it's not the end of the world, but we obviously try not to, because if we open that up, it's a little bit more of an infection risk. So we want to take out as much of that corn as possible. You don't always have to get it in the first go. You don't always have to use the 15 blade. You just use the blade that, makes the easiest job and least pain for the patient. And sometimes we use the same blade that we've been using for another corn removal. So that's what it looks like. That's quite a big chunk there. There's still a little bit to come out of that one. So we'll go back in there and clean that up, tidy it all up, get the patient to use some emollient, and then we'll sand that one smooth. We've got like a little rotary sand, it's like a Dremel tool, but more like a dental drill. Then we put a little sanding disc on, and it extracts all of the dust away, so it keeps the area nice and clean. So of course, the more of this we get out, the better or longer the effect will last, but it can be a little bit painful if we take too much on the first go. So that's what a corn enucleation looks like.